Hi, Dr. Fox. Thank you for being here with us today. Can you tell us a little bit about your research?
Sure. I'm a staff neurologist at the Mellon Center for Multiple Sclerosis at the Cleveland Clinic. And in that role, I am involved in a number of different research studies, MRI research studies, clinical trials, some large database research. And relevant to this meeting, I help direct a CCSVI study where we're looking at ultrasound, MRV, and pathology to understand CCSVI.
And why in your study did you use postmortem subjects?
Yeah, so there's been quite a few studies, and I'm sure over the next year or two there will be more studies looking at ultrasound and looking at MRV, MRVnography, using MRI to look at veins to understand more about CCSVI and its prevalence in MS and non-MS patients. We have a somewhat unique opportunity at the Cleveland Clinic where we run a brain donation program where patients, after they've died, donate their brain and spinal cord to our MS research program. It's a very important way for us to study MS because access to the organ involved, the brain and the spinal cord, is very limited during life. It's very rare for patients to get a brain biopsy in their evaluation or management of MS. So postmortem, or after death, is a great opportunity for us to get tissues, to harvest tissues and bring them into the laboratory to study them. We took advantage of that already existing program at the Cleveland Clinic and modified the consent form to obtain consent from the patient or their family or next of kin to, in addition to looking at the brain and the spinal cord, also looking at the veins in the neck and the chest to understand what is going on with CCSVI and how MS patients, how the veins of MS patients may differ from the veins in non-MS patients.
And what did you find when you conducted that study?
Well, we're still collecting the data and analyzing the data, but our preliminary data, we were able to study 7 MS patients and 6 non-MS patients. And when we compared the narrowing of the neck veins between the MS patients and the non-MS patients, what we found is there really wasn't much difference between the MS patients and the non-MS patients in terms of the narrowing of the veins, how skinny the veins were in MS patients versus non-MS patients. However, what we did find was a difference in what was inside of the veins between the MS patients and the non-MS patients. At least our preliminary data suggests that there are some abnormalities inside the veins that are more frequent in MS than in non-MS patients. Now, what these abnormalities are it varies from patient to patient, but it can be fibrous membranes that go across the vein or go longitudinally along the vein, and we think could disrupt the blood flow going through those veins.
And
that's fine, because it's just reference.
you mentioned the brain biopsy. I mean, is it life-threatening for a patient to have a brain biopsy? Is that why it's done so infrequently in a live patient?
Well, brain biopsy is done when it needs to be done. And it is an invasive procedure where the skull is open and a piece of the brain taken out. And it can be done relatively safely, but we generally don't do it unless it's needed to be done. In the vast majority of patients, we can diagnose MS and we can manage MS without the need of brain biopsy. We can use the clinical history, the examination, MRI studies, spinal fluid studies, and other tests to be very, very certain that they have MS or don't have MS. So in the majority of patients, we just don't need to go to brain biopsy because it's an invasive procedure. It does have some risks, and if we don't need it, we don't need it.
And you mentioned that you had 7 MS patients that you studied postmortem and 6 non-MS patients. Is that considered an adequate sample size?
Well, we are still collecting data, and we will, at the end of our study, have a total of 10 and 10 MS patients and 10 non-MS control patients. And what we feel is that that will give us a preliminary sense. Obviously, you would want to do dozens and dozens to be certain of the incidence. But we think that looking at 10 and 10 will at least give us a sense of the differences between MS patients and non-MS.
Is this type of research being done anywhere else that you know of? I mean, is there a similar study being conducted simultaneously elsewhere?
I'm not familiar with other groups who are doing this type of study. A tissue donation program is not very common. There are a couple around the world. There are a couple others in the US and a few in Europe. Most of them are restricted to just the brain, and as far as I know, don't extend outside of the central nervous system to involve things like veins in the neck.
Okay. And you mentioned some of the abnormalities that you're finding among the MS patients. What does that tell you? I mean, by looking at that and seeing these differences, where is it pointing you?
Well, I think the easiest thing is that we're not sure what this tells us. But what it tells us is that there are changes inside of the veins of MS patients. There are many questions that we don't have answers to related to that. Perhaps most importantly and of highest interest to MS patients is that related to MS. Does that either cause or MS, or is it related to worsening of MS symptoms? And we really don't know that at this point. However, what these observations do provide is an understanding of why there may be some differences using ultrasound between MS patients and non-MS patients. It may explain why there is some extra tissue that's seen within the veins, or there is some narrowing as evidenced by membranes within the veins in MS versus non-MS patients. It also may explain why many groups don't find frank narrowing of the veins, and it's not something that we're finding at autopsy. However, we're finding something different, which is things within the veins that may cause hemodynamic changes. It's very important, I need to emphasize, whether that's related to MS, whether that either causes MS or makes MS worse, we don't really know. One of the potential explanations is that MS patients do get catheters and do get medical procedures for various things. They have illnesses that put them into intensive care units more often than non-MS patients. And so some of this may come from the medical management of the complications that they have related to their MS. So these may not indeed be related to MS itself, but more the medical complications and the medical management that they receive related to their MS.
I'm told that jugular veins vary widely from patient to patient. Is that true?
We see some variations in jugular veins. We don't see as much variations as I expected based on what the MRV and the ultrasound sometimes tell us. We do find that some patients just don't have an internal jugular valve, that in about 15% of patients, they just don't have a valve on one side or the other. And this includes our non-MS controls as well, that they just don't have a valve. And it, as best as we can tell, just developmentally never developed. We didn't see any patients in our small study that had neither valve on either side. So there always was a valve on one side or the other, but there is a minority of people who don't have a valve on one side. We also found variations in how the valve looked. So some valves were 2 leaflets, some were 3 leaflets, some were only 1 leaflet. And so there was variation, anatomic variation in these valves. Also the vein that drains the spinal cord, the azygos or azygos vein. We found that some patients had a valve in that vein and some patients didn't. And in some patients it was 2 leaflets, some patients 1. So there was a fair bit of variation in the valves. However, all the patients had those veins. And there were no patients that were missing one vein on one side or the other.
So those variations then should not have any effect on diagnosis or treatment in terms of MS patients or patients with other neuropathologies? vascular disorders?
As best as we know, they shouldn't. At least as best as we can tell, there are people that have these valves versus not, some people who have 3 leaflets, some people who have 1, and occasional patients who have 2 sets of valves along a vein. And as best as we can tell, they, at least as far as looking at these veins, it does not appear that that would have hemodynamic consequences.
So what happens next? I mean, your study is sort of at a place of being about 3/4 done, and obviously I'm sure you can't tell exactly when it will be completed for obvious reasons, but when it is completed, what happens then? What are the next steps?
Yeah, so we have collected all 10 and 10 of the MS patients and the non-MS controls, and we're in the process of evaluating those tissues. So we have collected all of the tissues, and we need to finish evaluating them, 1. And 2, we need to do histology on those tissues. And histology is where we take the tissues and we look at them under the microscope to identify what are these membranes, what are these changes, these things we find within the veins, and from what do they arise and what sort of tissue are they. So that histologic analysis will be continuing. And then at that point, we'll see where we're at and see what directions to head into.
What is the most critical and important takeaway from your research at this point?
Yeah, I think there are 2 things that are critical. One is that, at least based on our preliminary data, there is not an increased frequency of narrowing of the jugular veins in MS patients versus controls. At least that's what we see when we look at the pathology. However, what we do see is evidence that there are things within the veins. There are abnormalities within the veins that may have hemodynamic consequences, and that may be what people are seeing when they use ultrasound. And it also emphasizes that when the ultrasound studies are done for CCSVI, as much as looking at the narrowing of the veins, they should also look within the veins for abnormalities within the veins.
What have I neglected to ask you, Dr. Fox, that's important for everyone to be aware of?
You know, I think you've asked all the key issues.